So just Christine, can you explain some more about the actual brain cycle?
Yeah, so every, let me get a toy here. Every organ, every structure in the body has a natural movement. Your teeth move, your bones move in their positions, everything moves a little bit. And so in CFT, we are checking very closely into the movement of the brain, and we call it the cranial rhythm or the cranial cycle, or we just call it brain motion. It's one of the first things you learn in this seminar is how to feel brain motion. And it's a pretty cool thing. It's a pretty cool thing to realize that you've got your hands there and, yeah, you just felt that. It's a very, very subtle thing to feel through the hair, the skull, the skin, and all that. But you will feel it. You will feel that expansion, move this forward, and the contraction, where that movement of cerebrospinal fluid is happening and the cranial bones are being pushed apart very slightly, and then you can feel everything come back down. This is another area where CFT, where the craniofascial work, differs from the paradigm taught in the craniosacral work, in that traditional osteopathic way of looking at the craniosacral system suggests that, you know, a 10-second cycle is fine, is healthy, is normal, is correct. In the craniofascial work, what we're looking for is for that cycle to just open and open and open and open and get into the several hundred seconds, if possible. The idea being that the longer the brain cycle is, maybe the more comfortable the brain is in its little spot, and therefore going to function at an optimal level. So we learn at the very beginning how to lay hands on gently and just wait for that change, and you can feel the brain literally moving in the head. You can feel them pushing and moving your hands, changing your hand position, and then you can feel it all kind of collapse down on itself. With your eyes closed, after you really tune into it, the degree to which it moves feels like a lot more than it would look. It's not something that you can see with the naked eye, but it's definitely present, and the longer it goes, the better. I make a habit, especially in the beginning, of checking brain cycle at the beginning of each session and then again at the end. And after a good CFT session, you can often see them double.
Wow.
Just in treatment.
So, and we're going to learn that when?
Day one. First technique. First thing.
Okay. And does everyone get it? Does everyone feel it? Is it something that's
by the end of the seminars? Yeah, by the end of the seminars, I find everybody is there. Sometimes it's one of those things where you can kind of get in your own way with it. You can really be trying too hard, but you know, I've been teaching people how to do this for a little over 10 years, and you know, they get it, and you can tell when they get it. Kim, Holly?
Sounds a bit like muscle testing, Holly.
It's kind of interesting because in the beginning of the seminar, you know, we'll teach the technique and then we'll trade off, and most of the people who are in the seminar have very tight brain cycles. So the students are feeling each other and they're like, I'm not feeling it, and we'll come over and we're like, well, it's because this is a tight brain. By the end of the seminar, because we've traded so much work, everybody starts to get a nice big brain cycle, and the students are able to feel that. But we do, you know, we will have students feel our brain cycle, so they in the beginning, so that they will get a lot of practice. They will feel a lot of different brains, and you know, we will make sure that they get this piece. It is critical. It is a great barometer for us as practitioners, and we're timing the cycle. We're feeling for the quality of the cycle, And as that all improves, as the motion becomes bigger and longer and stronger, there is a very high correlation between that good cycle and your client or patient feeling benefit. So that's and I'll say to people, it doesn't matter what I feel. It's going to matter how you feel, how your body heals. But the two correlate. So it's an excellent tool for us as practitioners.
Fantastic.
And it become a competition within the family as to who has the highest brain cycle.
What is typical brain cycle?
Say that again.
What is the typical brain cycle?
Yeah, I mean that will certainly vary from individual. We like to have a minimum of 100, which would mean that the brain is expanding for about 50 seconds, contracting for about 50 seconds, and it can go certainly much higher from there. But that's what we would like people to be at least walking around with, and it's really quite amazing that most people are just walking around with very, very tight brain cycle, tight bodies, causing a low brain cycle, I should say.
So what would it talk?
Oh, tight brain cycle, 0. Yeah, we can put our hands. Oh yeah, we will put our hands on and feel no motion, and that's a 0 brain cycle, and that's tight, and that's where you see people with chronic conditions and having a lot of issues. So. Yeah, 0 brain cycle.